So welcome everybody. We are absolutely thrilled that you are here live, or if you're watching this recorded, that you've decided to watch this webinar. My name is Rachel Justice, and along with my partner Jillian Levinson, who's on this Zoom, we run the Woman-to-Woman Gynecologic Cancer Support Program at Mount Sinai Hospital. So we're going to be spending the next 30, 45-ish minutes or so with you. And as you know, the title of this webinar is Be the Hero, a life-saving webinar. And this is a dramatic title because this is a dramatic issue. And you will leave this webinar armed with incredibly important information and hopefully feel very empowered by it. But before we get started, I'd like to, first of all, give a huge thank you to Nelson for this wonderful opportunity to spread awareness and to speak with all of you today. We'd like to say a huge thank you to PVH. Again, the fact that you have this type of platform is amazing. It is a gift to your employees, and we are grateful that we're part of it. And as we mentioned, Woman to Woman is affiliated with Mount Sinai Hospital. Our model has now been replicated and is in almost 40 sites throughout the country. And our goal is that no woman should have to face gynecologic cancer alone. And we provide emotional, educational, and financial support to women who are going through gynecologic cancer. Just as a brief overview of what we're doing today, September is Gynecologic Cancer Awareness Month. Jillian will start out by sharing some really important facts and statistics about gynecologic cancer. And she'll also be talking about both the medical and the psychosocial implications of the diagnosis. We have three amazing, wonderful survivors. They're going to be telling you their own personal cancer stories, and they will each have some teaching points that you'll hear about. And when you leave this session, you will hopefully have learned possible symptoms and signs about gynecologic cancer, which will increase your awareness and help you know when you need to take action. You'll understand the power of genetic testing, and you will discover how to become a self-advocate. I want to point out that if you look in the chat, the contact information for Woman to Woman is there, and it will be up throughout the session. It's our email, our website, phone number, and then my name and Jillian's name. And please feel free to reach out anytime. Save this information, use your phone and take a picture of it. We are here to help however we can. So without further ado, we're going to turn this over to Jillian Levinson. She's going to introduce herself. Again, she is our resident expert. As mentioned, she's going to share some really important statistics and really important information. It is action-packed and her slides are great, but they will be in the recording in case you want to go back and watch and read for more details.
Hi, everybody. My slides are called Gynecologic Cancer, Symptoms, Treatment, and the Mind Body. It's a very simple overview of what to know from a social worker's perspective. So what is gynecologic cancer? Gynecologic cancer is any type of cancer that begins in a woman's reproductive organs. Thus, the woman is at risk for developing gynecologic cancer. There are 5 main types of gynecologic cancer, which is cervical cancer, ovarian cancer, or known as primary peritoneal, uterine, which we know as endometrial cancer, and vaginal cancer and vulvar cancer. The physical symptoms and signs of gynecologic cancer are unusual vaginal bleeding, pelvic pain or pressure that is persistent, feeling too full, too fast, even when you eat just a little, bloating, fatigue, change in bathroom habits, unexplained weight loss, no noticeable symptoms, itching, burning, pain on the vulva, or discoloration of the vulva. I think what's really important to know is that the signs and symptoms of gynecologic cancer can be very slight or can be attributed to other types of illness or issue. Bloating, people could think, oh, I ate too much, I ate too many gassy foods. Vaginal bleeding, my period just happens to be heavy this month. Fatigue, I'm so tired, there's so much stress. And so it's not uncommon for women to disregard these symptoms, just assuming it's something else. So if you are experiencing symptoms, anything that's similar to these, please speak with a medical professional. Detection. If a doctor suspects gynecologic cancer, they may perform tests such as a pelvic exam, transvaginal ultrasound, CT scan, CA-125, Pap test, colon biopsy, endometrial biopsy, and or a DNC. As you saw, there are 5 types of gynecologic cancer, so the tests performed will be impacted by the type of cancer the doctor suspects to make a diagnosis. Common treatments for gynecologic cancer. Again, this is a very basic overview, but there are 2 types. There's the local treatments or the systematic treatments. Local means that the tumor is being addressed rather than impacting the whole body. So that could be surgery, or some women, it could be commonly known as the debulking surgery, which is a type of hysterectomy, and that's seen more with women experiencing ovarian cancer, or radiation treatment. Systematic treatments is where drugs used that can be reached other cancer cells anywhere in the body. So that's chemotherapy, hormone therapy, targeted drug therapy, and immunotherapy. Gynecologic cancer and you. Gynecologic cancer is tailored to the stage and degree of a person's cancer. A patient's treatment plan is unique to them, and everyone responds differently to cancer therapies. Communication with one's treatment team concerning the goal of treatment, symptoms, one might experience, and how to contact the provider is imperative. So you will hear from 3 different volunteers who are all survivors of gynecologic cancer, and their stories, their treatment, their cancers will all be different.
Early detection of things.
Common physical side effects of gynecologic cancer treatment. This is, again, I keep saying it's very basic. There are so many symptoms. These are a little bit more of the common ones. Peripheral neuropathy, which is a tingling of the extremities, mostly seen in the hands and the toes. It could be little tingling, or it could be to the point of significant pain. Fatigue and insomnia, hair loss, difficulty with memory and concentration, pain, nausea, vomiting, and loss of appetite, infertility, constipation, pain during sex and lack of sexual desire, premature menopause, weight loss or weight gain, and mouth sores are all common side effects. Gynecologic emotional and psychosocial implications of gynecologic cancer. So it's very common for people going through gynecologic cancer to experience depression, anxiety, a deterioration of body image and self-esteem. It's very often that there's a change of role in the household and the workforce, and that can really impact a person's emotional well-being. Feelings of dependency, helplessness, anger, guilt, and shame is very common, and there's a significant impact on one's sexual identity. So these are just the stats, and I'm going to go over the next few slides. Are a little daunting, but it's the numbers, and we want to make sure to include these so you know that really every woman can be impacted by gynecologic cancer. So for ovarian cancer in 2024, it's estimated that 19,680 new cases will be seen of ovarian cancer, and 12,740 women will die from the disease in the United States. A woman's lifetime risk of developing ovarian cancer is 1 in 87. While it's the 11th most common cancer among women, ovarian is the 5th leading cause of cancer-related death among women. Mortality rates are slightly higher for African-American women than for Caucasian women, and the relative 5-year survival rate is 50.8%. Ovarian cancer rates are highest among women ages 55 to 64. Cervical cancer. In 2024, there will be an estimated 13,820 cases of cervical cancer and an estimated 4,360 deaths from the disease. Cervical precancers are diagnosed more often than invasive cervical cancer. Cervical cancer is most frequently diagnosed in women between the ages of 35 and 44. Many older women are unaware that they're at risk of developing cervical cancer as they age. More than 20% of cervical cancers are found in women over 65. Incidence rates decreased by more than half from the mid-1970s to the mid-2000s, largely because of the increased screening. However, it's now stabilized. In women ages 30 to 44, rates have increased from 1.7% each year from 2012 to 2019. And in contrast, rates declined 11% each year for women 20 to 24, which is likely due to the HPV vaccine. the 5-year survival rate of cervical cancer is 67.4%. Okay, this is for uterine and endometrial cancer. In 2024, it'll be estimated there's 67,880 cases of uterine cancer and anticipated 13,250 estimated deaths. The 5-year survival rate is 80.8%. Endometrial cancer affects mainly postmenopausal women, and it's uncommon in women under the age of 45. This cancer is more common in African American women than Caucasian women. Over the past decade, incidence rates have continued to increase by 2 to 3% per year in African American women and 1% in Caucasian women annually. Uterine cancer is one of the few cancers with increasing mortality. Since the mid-2000s, the death rate has increased by 1.7% per year. Black women are more likely to die from uterine cancer. Okay, and vulvar and vaginal cancers are grouped together because they are the more rare malignancies of gynecologic cancer, and it accounts for nearly 10% of gynecologic cancers. There's 6,000 newly diagnosed cases and 5,000 deaths annually in the US. Vaginal cancer is more common in African American women, in African American people than in other races, although the incidence is low for all racial and ethnic groups. Vulvar cancer is more common in Caucasian individuals. Risk of vulvar and vaginal cancer increases with age, and a risk factor for both cancers is HPV. And then here is just the references of where the information, the stats are coming from. It's like the NCI, the American Cancer Society. Thank you.